Happy Friday, everyone. This is WLBT's Ask the Experts live from the Hub. I'm Kelly Boyd. Joining me today is Dr. Stephen Anderson from Baptist Heart. Welcome to the Hub, Dr. Anderson.
Thank y'all for having me.
Thank you for being here. So we have questions for Dr. Anderson that come from our Ask the Experts page on WLBT.com, but you are more than welcome to ask Dr. Anderson anything while we're live on Facebook. Okay, so our first questions, a lot of the questions are about heart failure. And so basically someone's asking, what is heart failure?
So heart failure is a condition, and the heart is not able to pump enough blood to meet the body's demands. And so, really, with heart failure, it's very, very common. We're kind of in the midst of an epidemic right now, and there's a total of 6 million patients in America right now in the United States that has heart failure, and those are projected to increase to about 9 million over the next 10 years.
Oh no!
So, what we really divide heart failure into two main categories, and that's based on really your ejection fraction. And that's something that a lot of people with heart failure become very familiar with. And a normal ejection fraction is about 60%, and that means that 60% of the blood is squeezed out of the heart each time. And so we divide our, from our heart failure, we look at heart failure with reduced ejection fraction, and that's somebody that the heart is weak, and so the ejection fraction is below 60%. Usually below 40% is what we call heart failure with reduced ejection fraction. And then there's a whole host of causes that can cause that. And the other one that's fairly common as well, and actually growing and it's becoming more common, is heart failure with preserved ejection fraction. Now, these people have normal heart function, but they still have heart failure symptoms, and the heart becomes really stiff and just doesn't feel quite as well as it should, and then it becomes, those symptoms come as a result of that.
Okay. Are there any other signs? That's the next question, signs of heart failure.
So by far and away, the most common sign of heart failure that most people present with is shortness of breath. And that's usually manifested itself as whenever you're walking around or doing things that you normally like to do, you notice that you can't do it like you used to. You get more short of breath, you get tired quicker, you have a lot of these problems come about from that. And so other very, very common problem from heart failure is swelling. So we typically get swelling in the legs. So whenever the heart is weak or the heart's not functioning appropriately in patients with heart failure, you tend to retain a lot of fluid. And so when you retain fluid, you get swelling. Gravity works. It usually goes down to your legs first, and that's usually the first place you notice it. Other common symptoms we see is sometimes people can't lie flat in bed at night, and they have to prop up in a chair. Whenever they try to lay flat, they can't breathe. They get a smothering sensation. You may have a cough. You may get heart racing or skipping beats or palpitations. You may get other problems, chest pain or anything like that. So all that being said, these are the symptoms of heart failure, pretty specific, but they can also, be other things that cause this, lung disease. There's a lot of overlap with other conditions that we see. So it really takes a good history and physical exam to really go through and try to sort out what's going on.
Okay. Thanks. Next question, are heart disease and heart failure different?
So my definition of heart disease really is a broad definition that encompasses almost all all the heart problems that we deal with, from valvular disease, from problems with heart rhythm disturbances, from problems with heart failure falls into that, and coronary disease, all these things I think we've talked about over the course of this series with Baptist Heart.
We have.
To some degree. So heart failure falls within that, but it is a different disease process in there, and it has its own specific treatments. All these diseases within heart disease have specific treatments for them, and heart failure is a process in there that has a little bit different treatments.
Okay. All right. So what causes the heart failure?
So that's a good question, and I usually spend a lot of time on this whenever my patients come in with heart failure. And so this is something that we spend a lot of time talking about, because I do feel like it is important to try to give a good shot trying to figure out what caused the heart failure. And we really divide the causes of heart failure really into two main categories. Number one being heart failure that's due to blockages in the heart arteries. And so we call that ischemic heart disease. And so the reason behind that, as I usually tell my patients, is if there's a blockage in those arteries, what we see is that area past that blockage, that heart gets starved of oxygen, and over time it can get weak. And so why is it important to try to find that cause? It's because potentially revascularizing them, or such as putting a stent in, doing bypass surgery, things like that can help that heart get stronger. The other cause is a little less common. Ischemic heart disease is by far and away the most common cause of heart failure. The other common cause we call is non-ischemic. These people don't have blockages. And so the most common cause for that type of heart failure is just long-standing untreated high blood pressure. And so with long-standing high blood pressure problems, this heart just over time gets weak and tired. Now there's a whole, a list, textbooks can be written about non-ischemic disease. So there's tons of problems that can fall within that. And so other things we see is certain toxins, certain types of chemotherapy can cause the heart to become weak even during chemo or even up to years after chemo. Okay. There's other toxins, viral infections can affect the heart as well and can cause it to become weak. And so there's a whole bunch in that category. And sometimes, despite an exhaustive effort, we really don't ever find the cause. And so it can be frustrating, but that's the case. And so, and regardless of the type of heart failure, the treatments are the same. So, if we don't find it, it's not something to really get upset about because the treatments it's not going to change your treatment course or anything that we do. The treatments are the same.
You just like to try to find out for the person what caused it, but treatment's always the same.
Treatments are going to be the same, yes.
Okay, good information. Okay, this is a two-part question. How is heart failure diagnosed, and what kind of tests might my doctor do to confirm I have heart failure?
Okay, so as far as diagnosing heart failure, as we've talked about some of the symptoms of heart failure, you got a lot of overlap with a lot of other conditions. And so it's very important that if you start having symptoms that you see your physician. It doesn't necessarily have to be a cardiologist, you can see anybody. And just your physician needs to perform a thorough physical exam, tell him him or her the symptoms that you're having, and go through they go through their exam and listen to your heart and see if there's any evidence that they can try to figure out. And if their suspicion is high, they'll either A, order tests there, or B, send you to a cardiologist. And then, so the tests that we order, I think the exam is probably one of the more important things that we do, but in the tests that we order, so as far as tests go, the first steps we do are usually just basic lab work, checking your thyroid function, checking the just basic chemistries. There's a lab test that we can check in the office that has checks the amount of fluid that you have in your body, and if you have a weak heart, that will probably be a little bit elevated. Just checking your kidney function, liver function, all those things, just routine labs, trying to find reversible causes. The next thing that you should get is an EKG, and so essentially what an EKG is, it's an electrocardiogram, and it's basically looking at the heart's electrical system on the waveforms on there. And so what we can do with that is that can show us information what the heart rhythm is. Is there a rhythm problem that could potentially be causing the heart failure? Is there evidence of an old heart attack on the heart failure? So those are things that we're looking for with that. Next, most people should get a chest x-ray. As I mentioned, lung disease can cause a lot of the same symptoms. So a chest x-ray can help us look at the lungs. It can also help us look at, is there the heart enlarged? Probably a lot of people have gotten chest x-rays and they said, oh, your heart looks big, and then that prompts further workup.
Okay.
And then the final test that we usually do is an echocardiogram, or it's the ultrasound or sound wave test of your heart. And so what that shows is the same thing as a sonogram that you get whenever you're pregnant. And so we're just looking at the heart. And so that actually is a wonderful test, shows the heart function, shows all the valve problems, and we can get a whole lot of information from that study. It's quick, it doesn't take very long, and the amount of information we can get is very valuable. And we can use that to trend things, see if there's been improvement in the heart function, see if there's been any changes that we need to address. So it's a wonderful test.
Sounds like it, yes. So once you've diagnosed heart failure, you say all treatments are the same. The next question is, how do you treat it?
So the treatment for heart failure is very standardized. We know really well how to treat heart failure. And I would probably argue that there is very few things in all of medicine that have more information and more data behind it as far as for heart failure goes. So we know really well how to do it. And most of the treatment is really just goes around medications. And so we know there's medicines that we have that make you live longer, feel better, keep you out of the hospital. And so that's our goal with heart failure. And these are medicines that people probably know all the time. They're just common blood pressure medicines, lisinopril, losartan, valsartan, all those things like that. These medicines fall into a class that we call ACE inhibitors or angiotensin receptor blockers, and that class we know is a very good class of medicines that helps people feel better, live longer, stay at the hospital. The next class of medicines we look at are beta blocker classes, and these are medicines that people hear all the time too, just regular blood pressure medicines, metoprolol, corbetalol. So these are medicines that every patient with a weak heart needs to be on, or needs to at least have an attempt to try to get on them. There's a new medicine that's come out recently. People have probably seen the commercials for it, is Entresto, and that is a new medicine that has really good data behind it. And it is designed as a substitute for the lisinoprils and valsartans and losartans and stuff like that. And we're trying now to get our patients on that the best we can. Sometimes we're limited due to cost because it's a new drug and quite expensive at times.
Okay.
Most people, as I mentioned earlier, with heart failure have some degree of fluid buildup. They're going to have swelling and all that stuff. So most people are going to require some degree of a diuretic medications. Like, the most common diuretic we use is Lasix, and the dose is going to depend on the patient and how much they need. And some patients don't require any, but most patients, I would argue, do require a good bit, some Lasix.
Okay, for the fluid retention.
For the fluid retention, and that's one of those medicines that just really makes you feel better. So, it's sometimes going to be a trial and error process how much they need, but usually we figure out what the dose is and can get you on that, and that medicine's good to keep you out of the hospital from fluid buildup.
Okay, perfect. Okay, I'm going to take some questions from our Facebook Live.
Okay.
We have one from Tammy Hodge. She says, can you have a heart attack from a mitral valve regurgitation?
Mitral valve regurgitation?
Is it regurgitation? Okay.
Yeah. So can you have a heart attack from So mitral valve regurgitation is something I think Dr. Water actually talked about earlier on in one of the segments. So mitral valve regurgitation is essentially, there's 4 main heart valves that we deal with. There's 2 on the right side of the heart, 2 on the left side of the heart. And the mitral valve is one of the more common ones that are involved in, it's probably the second most common valve that we have problems with. And so whenever the valve leaks, essentially it pushes, the blood's not going the right way. It's starting to go, going back in toward the lungs. And so, will that cause a heart attack? Probably not. And so there's, trying to think of a reason that it would. And sometimes people with mitral regurgitation, if it's severe mitral regurgitation, can have problems with atrial fibrillation, which can lead to clots in the heart, and a clot potentially could go down there. But if you do have a heart attack with mitral regurgitation, it's probably not related to the mitral regurgitation.
Okay. Susan Hall Anderson says, tell him hello from his wife.
Hello.
All right. Liz Holland asks, what are your treatments for HCM with a genetic history?
So that's a good question. So HCM is a hypertrophic cardiomyopathy, and that is, for most cases, an inherited syndrome that affects the heart. The heart it can get thick in one certain area. And these patients can, when their heart squeezes, can actually form it interferes with the blood trying to leave the heart, and it can cause symptoms of shortness of breath, and it can be very debilitating. In certain instances, in certain phenotypes, in certain types of with the genetic history, and there's certain genetic histories that make you more prone to having risk of what we call sudden cardiac death, where you have heart rhythm problems that you can pass out and die from. And we have certain risk factors that we look for to determine their risk with that.
Okay.
Now, the treatments for hypertrophic cardiomyopathy are typically medications, and they're medicines that we try to do to make that heart work a little less vigorously and try to improve your symptoms. And they're the same medicines I talked about earlier. They're beta blocker class medications. Metoprolol is the one that we most commonly use. And sometimes people can't tolerate metoprolol, and we have to change around therapy a little bit. Verapamil is one that we would use. And there's kind of last line agent is another medicine called disopyramide that we would also try to use to try to help that heart function a little less vigorously and make you feel better. Now, and kind of down the road, if medicines don't work, there's always therapies, surgical therapies, where they can go out in that thick area of the heart. They can try to cut that thick area of the heart out, and that relieves some of the symptoms.
Okay.
There's certain individuals that you would actually need to have a defibrillator placed in the heart to try to minimize that and minimize that risk of death. And then there's also, for people that aren't surgical candidates and can't go for surgery, there's actually procedures where they can try to do in the cath lab procedures where they can try to minimize that amount of obstruction that occurs.
Okay.
So there's options, and we generally can get people feeling a little bit better. There's some people that we have a hard time with. So.
Okay. Thank you for your answer, Liz. Vicki Turner asks, after a heart attack, what do you do to build the strength back?
So the way we treat heart attacks now, we want you to get up and try to start moving around pretty quickly. I mean, it's you know, whenever somebody has a heart attack, we're usually kicking you out the hospital within 2 days almost. I mean,
Wow.
it's pretty quick now. So we want you to get back on your feet, and we want you to be moving around and building your strength back up. The best thing that I can suggest for trying to determine when is it safe to really get back to your full capacity is cardiac rehab.
Okay.
And it's indicated really in everybody that's had a heart attack. And so what cardiac rehab is it's a supervised exercise program that is indicated for people that have had heart attacks, heart surgery, heart failure, and everything. And so what it does is they monitor your heart rhythm while you do your exercise, and they kind of watch for signs that things aren't going well.
Okay.
And so if they see something, they tell you to stop. And what it does, it does, you know, marvelous. And you start slow and gradually build up, and then they kind of let you graduate from the program once they feel like you're okay.
Okay.
It also works really well for heart failure, kind of staying with what we were, you know, initially started talking about today. It works really well for heart failure as well.
Okay. Kevin Turner says, after a heart attack, I still have chest pain like the first time I had the heart attack. So it's something he should probably get
probably get checked out. That's generally speaking, that's one of the questions we do ask is the pain very similar to what it was the first time? And you know, that's usually going to mean that it's, you know, potentially could be something. Is the stent's not, you know, doing well? There's another blockage that's causing problems. So I would definitely seek some care for that.
All right, Kevin, you want to get that checked out. Good luck. Hi, Roberta Wright. She says hello. Liz Holland, she may have been asking the question a second time because isn't this the same as the HCM question, hypertrophic cardium?
Yes, she says the same. Yes, okay. That is the same question.
All right. Michelle Addy says, great heart doctors at Baptist. Her daughter's is Dr. David Braden. So that's good news. Let's see. And Liz Holland was saying back about the other question. She said, yes, we have the history of sudden death and ICD. Thank you. Same question on how do you build your strength back after a heart attack. If you'll just rewind just a little bit, you'll hear that information, Kevin. Let's see. I've had a heart attack. This is from Donnie Bird. I've had 2 heart attacks and 11 stents.
Wow.
I'm having issues with dizziness and accelerated heart rate. Any suggestions?
So the dizziness, a lot of times whenever somebody has a heart attack and has 11 stents, we're going to be bombarding you with medications, blood pressure medicines and things like that can cause dizziness and stuff like that. So that would be my first thing to look at is your medicines and see if we would need to back off anything. But I would definitely see your physician because some medicines we probably can't, it'd be hard to get them off. And then as far as the accelerated heart rate, you know, patients with heart disease are definitely at increased risk of getting atrial fibrillation. So that would be something I would get concerned about, and you know, maybe a heart monitor might be something that would be, potentially could wear.
Okay. Kathy Oliver says, can I have a heart attack if I lead a sedentary lifestyle?
So sedentary lifestyle is at risk for anything, and what we always try to recommend for people to do is eat a healthy lifestyle and try to get some exercise. And so we want, the American College of Cardiology recommends 150 minutes of exercise a week, usually divided, at least 5 days. And so we always recommend that, and that does wonders for your heart, does wonders for blood pressure and everything like that. And I would really, I wouldn't, it depends on a lot of the other medical problems, how much at risk you are, but I would definitely say just living a sedentary lifestyle would put you at increased risk of somebody that would be very active.
Most of your colleagues from Baptist Heart have recommended about 30 minutes a day or to shoot for that much, and if you split the difference, you're doing okay.
Yeah, so 30 minutes of moderate intensity exercise is perfect. That's what you need. And the benefits are I can't stress it enough, the health benefits of doing that.
Okay. Thank you. I'm going to go back to questions from our Ask the Experts page.
Okay.
Let's see. We have, speaking of lifestyle, what kind of lifestyle changes should a patient make if they've been diagnosed with heart disease, heart failure?
So whenever I have a patient with heart failure, I guess more so with any aspect of cardiology, is diet is very important. And what I always tell people, salt is your enemy now. And because wherever salt is, that's where water goes. And if you're having problems with swelling, you don't want all the water built up.
Right.
And so, increased fluid, increased salt intake can lead to increased shortness of breath, increased swelling, can lead you, to get in the hospital just from dietary noncompliance. And so what the recommendation is 2 grams of salt per day. You try to limit less than that, and 2 liters of fluid a day. And so 2 to 3 liters of fluid a day. If you're out exercising or working in the yard and you're sweating a lot, then you can be more liberal with your fluid intake. But you just kind of use common sense. Don't do a lot of fluid. The salt thing is very difficult in Mississippi trying to do. Our food is loaded in salt, and trying to have patients trying to minimize that can be difficult. And common things that we see that have a lot of salt in them that people don't really necessarily. Your processed meats have tons of salt in them. And then the canned vegetables surprisingly have a ton of salt in them as well. And so
even the low sodium version.
Even the low sodium version. So those are things that we try to avoid. Try to eat fresh fruits. Fresh vegetables, things like that.
And then frozen is better than canned if you got to go in between.
If you got to do something, then frozen would definitely be better. And then if you're a salt addict, then you have to have that taste. And Mrs. Dash, I've never tried it, but they say that it's a decent substitute for having to add to your food for salt. I haven't actually tried it. With regards to lifestyle changes, like I said, we want you to do activity. We don't want you to be sedentary. We want you to be able to get up, move around. The guidelines are clearly recommend that we don't want heart failure patients to do anything. We want you to do the same type of exercise that we recommend for everybody if possible, and that would be our goal, to get you to be able to do that kind of stuff.
I know we finally got my dad out of the habit, but years ago he would salt his food before he ever even tasted it. We finally got him to stop doing that. He's still big on salt, but
as a cardiologist, I've been guilty of doing that too. So
you got to practice what you preach.
I got to practice what I preach.
Okay. The next question has 3 acronyms in it, so you'll have to explain what they are. They've asked, can you talk about the differences between ICD, LVAD or LVAD, and CRT?
Okay. So
what do those stand for?
So ICDs and CRTs are very similar devices, so I'll kind of talk about those second. So an LVAD, or a left ventricular assist device, is essentially a mechanical heart pump that's surgically placed in the heart. And whenever I'm describing this to a patient that it might be an option for them, it's essentially like a sunk pump. It just sucks all the blood out of the heart and then injects it back into the aorta and just takes the workload off the heart, and it basically does all the pumping for the heart.
Okay.
Many people remember Dick Cheney, the former vice president. He had one as he was waiting on transplant. He did have one of the heart pumps for a little while.
Okay.
While he was waiting on transplant.
Right.
And so they're not reserved. Not everybody gets an LVAD, and it's really reserved for just the very, very, very severe people in heart failure.
Okay.
And it can be used for 2 reasons: as a bridge to transplant, as Dick Cheney's was, as somebody that's really sick and they can't stay out of the hospital, so you use it as a bridge to temporize measures until you can get them to a heart transplant or more definitive therapy. Or some people this is their only therapy that they can get, and so they have this for the rest of their life. And so there's only one center in Mississippi is UMC that can put these in. We don't place them at Baptist. We don't follow or manage them at Baptist. So if you were to be considered for one, you would have to go to UMC and get there. They got great doctors there that manage those. And so that would be your destination if that's where you're going.
Okay.
ICDs and CRTs are a different type of therapy. And so an ICD stands for implantable cardioverter defibrillator.
So these are all devices.
These are all devices that are put into the heart. And so an ICD is to kind of understand why you put an ICD in. So patients with heart failure, or select patients with heart failure, are at increased risk of having sudden cardiac death or just having, the heart rhythm problems where you all of a sudden pass away. And so what the ICD does is it's planted under the skin, usually right here under the left side of the chest, and it through the vein it has puts a lead into the heart. And what it does is it's like an insurance policy. It sits there, monitors your heart rhythm day and night, and you don't want it to do anything. But if you do go into one of those rhythms, it can shock your heart and potentially save your life.
Wow, okay.
And so that's what you want it to do. And the common misconception I get from patients is I can't wait to get my ICD because I'm going to feel better. It's not going to make you feel better. You don't want it to do anything, because if it's doing something, it's shocking you. So the ICD is not going to necessarily make you feel a lot better, but it's something that's a very important part of your treatment to try to make you live longer. So next thing is a CRTD, and this is a little bit more complicated device, and it stands for cardiac resynchronization therapy. And what happens with that is it does the same thing an ICD does, where it monitors your heart rhythm and can deliver shocks for bad rhythms, but it's designed for even more select patients with heart failure. Very, very select patients. Very few patients can actually be approved for it. And what it does is it uses a pacemaker function to help the heart function much more efficiently. And by functioning more efficiently, in some individuals, the heart can actually return to normal function. And so this is a device that can actually make you feel better. And so that's one that we would recommend in certain individuals that have the classification, because I mean, I've seen a lot of people where the heart goes from really reduced to completely normal with just this device, and it can be a really good therapy.
Okay. Next question, can you make your heart significantly stronger through exercise and dieting?
Okay, so exercise and diet are very important treatment approaches for heart failure. And so the recommendation is, so for heart failure, it is exercise will make you feel better. It'll potentially make you live a little longer, and it definitely keeps you out of the hospital. And that's really the things that we're looking for. It does make you feel better. Now, will it help the heart get stronger? Probably not a lot. It's not going to do a lot to strengthen the heart, but it's going to make you feel better. So that's a very important part of our therapy, is the way you feel. Same thing goes for diet, and diet's not going to be something that is really going to make your heart stronger, but diet, like I mentioned earlier, is a very important part of your heart failure therapy, is because you really got to watch what you eat, because if you don't, you're going to end up in the hospital.
Yeah.
Now the way I look at things is, as far as diet and exercise is a preventative measure. And so the risk of you developing heart failure over the age of 40 is about 20%. And so that's, amplified in people with high blood pressure, diabetes, obesity, and high cholesterol. And so this is, I think, where diet and exercise can really do things to prevent you from getting heart failure. Doing regular exercise, adhering to a very good diet, and trying to get weight down, blood pressure down. All these things will be beneficial down the road of trying to help prevent from getting heart failure.
Okay. Let's see. In what ways does heart failure increase my health risk?
So, having heart failure is not a good thing to have, as you can probably imagine.
By itself.
Yeah, and so to not sugarcoat things, once you get a diagnosis of heart failure, your chance of not being here in 5 years is about 50%. Okay, so it's bad. So it really can affect your quality of life, health care, and everything from that side of things. And so that's where it really becomes important to be really compliant with medications. And I tell all my patients that. I'm very honest with them, because I think knowing how bad it is really makes you really want to take your medicines, do the diet right, do everything, follow it, have your appointments, and show up at the appointments and do things the correct way, because it can be a tough disease to treat.
Okay.
And the mortality rate really rivals that of some cancers. It can be as pretty bad.
Wow.
And Mississippi's rate is, as most things in Mississippi are, we're one of the worst in the country. So we need to do better, and so we got a lot of room for improvement. So
all that salt and not wanting to walk it off.
Yeah.
Okay. And let's see, what are the most important things that I can do to manage my heart failure?
So I can't stress enough, medication compliance. And what I usually try to get my patients to do is, they, be able to know your medicines forwards, backwards, know what medicines you're on, what dose you're on, how often you take the medicines. I think all that's very important, because that's engagement by the patient gets very engaged, and they understand that this is important for them. And dietary compliance is very important as well. And trying to manage your and following up appointments. It can be tough to try to come to all the appointments and take all the medicines. It can be a big change in your lifestyle, but it is very, very important that you do all that stuff, and that's how we can try to manage heart failure the best way.
Definitely. Okay. We've got quite a few questions on Facebook as well. I'm going to take some of those. Gail says, can you get off of, okay, this must be a name of a medicine, Entresto, not familiar, for heart failure if you are up to 45 EF?
So that's a good question, and that's goes into this kind of new realm that we're getting in. So when we're getting better medicines and doing a better job of treating, a lot of these people are seeing their heart function improve and getting to these where they're kind of out of that danger zone from heart rhythm problems. And a 45% EF is close to normal. And to be honest, we really don't have a lot of data to suggest that being aggressively treating somebody with an ejection fraction of 45% is good. In your situation, if you were on Entresto, I would say your heart function was at one time probably fairly reduced. And so my approach with this is I try to continue the medications as long as possible because, why did your heart function improve? Was it because of the medicines? And if you stop the medicines, I always get nervous that there might be a potential for that heart function to go back down again.
Yeah.
And so if you're not having problems with it, it's probably reasonable to continue it.
Okay. Gail also asked, how can you exercise when you have no energy? Oh, no.
Yeah, so that's a tough thing to do, and cardiac rehab is a good thing for that, and
it kind of build up to it.
Yeah, it's a build up to it because it takes you got to start off really slow, and what a lot of times I find what really patients is it's tough with the energy thing because patients with heart failure can really have horrible energy. The energy levels can be very low. They feel horrible, and so, but what I do find a lot is, patients. They get scared to exercise because they're scared. I got a weak heart. I can't exercise.
Gotcha.
And that's where I find cardiac rehab can be very helpful because they have somebody watching them exercise, and so they have that reassurance that look, if something's bad, they're going to stop me.
Right.
And then I feel like a lot of times they feel like they can have a sense that they can get, they can have more confidence. They say, oh well, I can do more than I thought I could do, and so that works out better in I think everybody's favor.
That sounds like a good option to me, Gail. Ed says, if after walking 2 blocks I'm out of breath and tired and dizzy, does that mean I might have heart issues?
It could be. That is could be a symptom. Most of the symptoms of heart failure and heart disease come with exertion. So whenever you exert yourself, if you notice different symptoms, it could be that. It could be lung disease. It could be a whole host of things. But I do think it's something that's worth getting evaluated.
Okay. John Harlow says, do you think vaping is harmful?
That's a good question. So smoking is definitely bad. I mean, we know that. You don't need to have a lecture on that. And vaping, I think the jury's still out. I think there's a lot of press now with certain types of the vaping products causing some lung disease. One of my mentors when I was in residency at UMC told me there's nothing good that you can breathe into your lungs that is not air, and so I've kind of always taken that approach. So,
right.
If it's not something natural, then it's probably not good to breathe into your lungs. But if it's a way that you're using as a try to get off of smoking, I would say it's if it's helping you quit smoking and you're got a plan to get rid off of vaping, it's probably a reasonable approach.
Okay. Great advice. Back to questions from the Ask the Experts page. How quickly does heart failure progress?
So that can be a difficult question to answer. So that depends a lot on the patient,
lot
on the individual, a lot on the type of heart failure. There are certain types of heart failure that can progress very quickly over the course of a couple of weeks. And so, those are the very rare, can be very bad. And so those are things that we, kind of look for. But a lot of that depends on the patient and the individual, how compliant you are. If you don't take your medicines, if you don't really adhere to diet, it's going to progress a lot quicker than the person that does everything correctly. So, and things we look for to determine the progression is hospitalizations. How many times are you in the hospital? If you're in the hospital 4 or 5 times a year, that's a sign that your disease is progressing.
Yeah.
And so we need to, kind of sit down, kind of huddle up and try to find a new plan for you. And are we doing everything right, and what we can do better to try to help you.
Okay. Good. How does being diagnosed with heart failure affect your lifestyle and activities?
So, as far as your lifestyle, it potentially is going to change quite a bit. I mean, your diet's going to have to change. You're going to be taking medications. These medications might have side effects, might make you feel a little, not quite very good. You're going to be taking diuretics potentially. So a lot of things are going to change. And you're going to be going to a lot more doctor's appointments. And so you're going to have to try to find time to try to work those into your schedule. And what I usually try to tell my patients is my goal with somebody with heart failure is, as far as what you can do physical activity, is to get you back to what you can do what you want to do. Because if we can't do that, then I don't feel like I'm really doing my job. Because it's not, if you're still just miserable, sitting down, can't do anything, then we need to be doing something different, because we need to get you back where you can be feeling good enough if you want to go fishing or do something like that. You know, you may not get to where you were running marathons again, but we can get you where you're at least happy doing stuff.
Okay. All right, next question. I think you may have mentioned it in a previous question from Facebook. My doctor mentioned a cardiac rehabilitation program. What is that? Is that where you're talking about they do the exercise?
So, yeah, that's the what we talked about earlier. So cardiac rehab essentially is just supervised exercise, and it's got indications that it's you know, for people with heart failure, people with recent stents, people with recent bypass surgery or heart surgeries, and you know, things along those lines. And so it you know, the benefits are just, you know, through the roof, and it's most hospitals have it. There are a lot of communities actually have it. So there's a, you know, there's a lot of facilities in Mississippi where you can actually get cardiac rehab fairly close to you. So
okay, that might be an option for Ardella if she's had a previous. So it's if you've had a previous diagnosis for your heart.
And there's some insurance issues as well, as that, you know, try to they can be a little bit tough to try to, you know, when your last heart failure hospitalization was and how close it was to where we're doing the referral. But
okay. She was asking, when you're overweight and have bad knees, what can you do for exercise?
So, you know, that's a tough thing. So, you know, a lot of gyms now have a swimming pool, so water aerobics and things like that. So that takes a lot of the weight off your knees, and so you're able to do some exercise. I actually had a patient the other day in clinic that's lost about, you know, I think 15 pounds doing water aerobics, and so it's not something that I routinely think about, you know.
I know.
Having,
someone just mentioned that to me the other day. They had that at their business, and a kid over the summer lost, she was overweight and lost like 15 pounds.
Yeah, and so that I would say that, you know, that would potentially be a good option, because the water, you know, you don't put a lot of weight on your knees, and the hope would be that as the weight comes off, the knees would feel better, and then you could get out and actually do some other stuff as well.
It's almost like you become weightless in the water.
Yeah, that's
pretty neat.
I'd never think about it, but the patient I saw the other day, he actually mentioned it. So
good. That might be a good option. Okay. What type of medications, we've talked about them, you may want to mention others. What type of medications do you have to take once you've been diagnosed with heart failure?
Yeah, so we kind of talked about that earlier, was the medications are mostly, they're mostly blood pressure medicines. You know, the most common ones, lisinopril, enalapril, losartan, valsartan, all those medicines are medicines that are commonly used for blood pressure that we can also treat heart failure.
If you have your TV on right now, you've probably seen a commercial while we've been live.
And then so Entresto is another one that we use now to substitute for those. And then other medicines are metoprolol, corbetalol, are medicines very commonly used, and that falls in the beta blocker class. There's other medicines that you might end up getting on is you know, spironolactone or eplerenone are medicines that select individuals with heart failure can get on, and so those are just additional blood pressure medicines and diuretics. And so there's a whole host of medicines, and sometimes people end up being on 4 or 5 different medicines, and it can be a pain. Heart failure, though, the medicines, generally speaking, we can actually get around. You know, your medicines can be actually pretty cheap, and so we can. That's one of the, I guess, the fortunate things with the medicines we use is most of them are generic, and most of them can be manageable for most people.
Okay. Once someone in my family is diagnosed with heart failure, what signs or symptoms should we pay attention to know to call for an immediate ER visit or call for an ambulance?
Okay. So, like I said earlier, we don't want you to go to the hospital if you don't have to, because that's a sign that things are getting worse. And so what I usually, for my patients in clinic, what we do is I give them some instructions on how to manage their fluid at home. And so what we do is I have them weigh every day, and if their weight goes up by 2 or 3 pounds in a day, chances are that's going to be fluid. And so I have them take an extra dose of fluid medicine, try to beat this before it gets to the point where you have to come to the hospital. And so that is a fairly good approach. It can be a little complicated and certain, you know, trying to manage this, because it can get a little bit overwhelming, and if that continues to happen, I would definitely call your physician. One, you know, things to look for bad. So worsening shortness of breath, not able to get around the house, swelling so bad you can't, you know, it's just gotten so worse. You start having chest pain, that's something to always get concerned about. You know, passing out, unexplained passing out episodes are things to get concerned about as well. So those are things that I would seek immediate medical attention for.
Okay, great advice. Thank you. Tell the viewers how they can find out more information about you or Baptist Heart.
So you can call our office at 601-968-1966, or you can visit our website at baptistheart.org, and you can find more information about the procedures that we do, more and all our physicians in our group.
And one of your colleagues, I believe it's Dr. Bellin, he's going to be in the hub with us live for Ask the Experts on September the 25th at 2 p.m. I'm sorry, that's the 24th. I've got the page pulled up. You can go to our Ask the Experts page on WLBT.com to view that live schedule, send questions for all our experts. On Monday, we'll be live from the hub with Morton Law to discuss elder law. So send your questions in for that episode. Thank you so much for coming in today.
Thank y'all for having me.
Thank you. Is there anything you'd like to add for the viewers?
Not right now.
Not right now,
No.
but go to see him if you need him
Yes.
for sure. Thank you, Dr. Anderson.
Thank you.
Thank you all for your questions, and thank you for watching WLBT's Ask the Experts. Have a great weekend.